What's coming down the pike from a therapeutic point of view, we'll have to see if it works in epilepsy, but now focused ultrasound is something that's being explored. There's a study underway to examine efficacy. The data right now is preliminary, but in an utterly non-invasive fashion, you can put people in an ultrasound delivery machine that focuses multiple beams of ultrasound, and where they intersect is where the action takes place, so to speak. So you can deliver damage to a very specific targeted area of the brain within a couple of millimeters and destroy that area that way, which is even better if it works than having to drill a hole and put a probe in. It creates damage in the brain and destroys tissue, and by multiple techniques. It actually can heat the brain, it can cause mechanical disruption. You can take focused ultrasound for that matter and disrupt the blood-brain barrier even, and deliver agents directly to the brain, for example, if you had a tumor that you wanted to treat directly. Where that will fit in epilepsy is hard to say. It's been done preliminarily at a few places in deep brain structures for tremor. The issue in epilepsy in the region of the hippocampus is that bone is very nearby, and dealing with the bone will be a little trickier. And cortical lesions are also adjacent to bone. But these are all technical issues, I think, that should probably be able to be overcome. So that again is something that's promising coming down the pike, and we'll learn more about it. Brain stimulation is another method. Responsive neurostimulation has been out for a few years in the US. The FDA approved deep brain stimulation more recently. That's been approved less than a year in the US, though that's been available in Europe for about 8 or 9 years, I think. Deep brain stimulation is a method that can be used when you don't have a precise focus that you can resect, or two foci that you could use responsive neurostimulation for. In this case, you don't even need to know where it is. Electrodes are placed in the anterior nucleus of the thalamus on both sides, attached to an external stimulator that's placed under the skin on the chest, typically on the right side, and current can then be delivered to the thalamus however doctors wish to program it. Right now, the standard technique is similar to vagus nerve stimulation programming, where they're stimulated for 30 seconds and then off for a few minutes and then stimulated repetitively. This technique appears to diminish seizure frequency as well, and some people, like RNS, also have periods of time that they can go without seizures. So perhaps 15 to 20% of people may have 3-month intervals without seizures, which is a significant improvement when you look at the baseline seizure frequency in patients in the study.